Today I'm sitting down with world-renowned celebrity plastic surgeon and founder of Metacine, Dr. Jason Diamond. Jason, Dr. Diamond, welcome to DITL.
My pleasure to be here. Thanks for having me.
Thanks for coming in. I am so excited to do this with you because you are the guy in Beverly Hills and really in the world to see for facial plastic surgery, and you've built this incredible business. So I can only imagine what your day is like, and now we're going to hear it firsthand.
Yeah, there's a lot that goes on for sure.
So
tell me where to start.
We're going to start at the beginning of your day.
Okay, very good.
What time do you wake up, and how do you get your day started?
I usually wake up, I can't remember. The only time I will set an alarm clock is if I have like a 6 a.m. flight that I have to be up at like 3. But if it's a normal day, even a surgery day where I have to be in at 7, I don't set an alarm clock. I have an internal alarm clock. I wake up at 6 o'clock like every day. I go to bed at 4 in the morning. I'm going to wake up at 6. Like, I don't ever go to bed at 4, but it doesn't matter what time I go to bed. I'm up at 6. So I don't ever set an alarm clock. I just wake up and it's always within 5 minutes of 6 o'clock. And so I get up. I don't hit any snooze because there's no alarm. I walk downstairs and then I start doing what I'm going to do.
Okay. Into the office.
Into the office.
And how many patients are you averaging seeing a day?
Probably 20 to 30 people a day. If it's a in-office day. If it's surgery, then it's just surgery all day. Yeah, and then it's just one person on max 2 for surgery on that day. But if it's an in-office day where I'm doing non-surgical things and consultations, yeah, 20 to 30 probably.
And what are most people coming in to see you for?
Well, I'm a facial plastic surgeon, so most people are coming in to see me for concerns with their face or their neck, anything from neck and above. We do body procedures as well that are non-surgical, like the skin tightening and the body tightening lasers and devices and things like that. But surgery, it's only neck and above.
And what are some of the most common procedures and asks you are seeing in your office right now?
Non-surgically, I'd say the 2 most common things that people see me for is diamond facial sculpting and the diamond instafacial. These are 2 of our signature treatments that literally people fly in from all over the world for, and people fly me all over the world to take care of them for these procedures. Of course, I do Botox and lips and things like that as well, but these are really the things that are probably the 2 most popular things that we do. Non-surgically.
Mm-hmm.
Surgically, I'd say the most common thing people come to see me for would be aging face concerns, things that are making them look tired. So that could be facelift, neck lift, full face rejuvenations, things of that nature, and also a lot of rhinoplasties and nose reshaping. So those would probably be the most common surgeries that I do.
In addition to the surgeries and non-surgical procedures that you're doing, what would you recommend to patients to also be focusing on in terms of taking care of the skin and taking care of their face?
Well, taking care of the skin, that's the Diamond Instafacial. That's our signature skin treatment that we developed, 10 or 12 years ago, which is a bioregenerative based treatment. And so that's one of the most common things that we do for people. And that is not only does it reverse aging skin changes, but it's preventative as well. And so that's probably my go-to and the most common thing that I do for that. We do a lot of preventative things. And of course, the Diamond Instafacial, which is, it's a multimodality treatment involving taking somebody's blood, turning it into plasma, injecting that into the skin strategically, into the different layers of skin, laying it on the skin superficially and using needles to penetrate it in, lasering it in, and using medical grade collagen. That's the combination that makes up the Instafacial, and that's what we based the Metacine off of. So within Metacine, my skincare brand, we launched with the Instafacial collection, which is 2 products, and they were designed specifically to mimic the in-office Instafacial results. And so these are the most common things I do for people's skin, those 2 things.
I saw recently you posted Kim Kardashian in your office, and she was talking about her obsession with hair stem cell products. What's the deal with that? And what is that?
Yeah, there are a lot of different things that we do, and I take each person case by case. But there are several different bioregenerative type treatments that are very effective for hair. Sometimes we do what we call based off the instafacial, we call the Instamane. It's a similar type of treatment where we use somebody's blood, inject that, roll it in with needles, and laser it. And sometimes we use a more growth factor rich treatment called exosomes. It's like a sort of like a stem cell therapy. Sometimes we'll use somebody's own fat and take what we call nanofat, their own stem cells from their own fat, and use that. So it just depends on the situation.
And what's the outcome of that? Like, are you hoping for fuller hair, a fuller hairline, like thicker hair? What's the outcome for that procedure?
It's all of it. It's all of what you just mentioned. Some people get just a better quality to their hair. Some people will see hair growth where they thought they were thinning, or even have several bald patches. A lot of people end up with these little patches all over the place that aren't growing hair, or hair fell out. It's very effective for that many times, and just an overall improvement in hair quality.
Do you see a lot of women who come after having kids for that?
Yes, we see a lot of people, because a lot of people feel their hair thin during that time frame. Yeah.
When do you say no to someone during the day? Like, you are probably seeing a lot of people who come in with ideas, or I saw this, or I want this, or everyone's talking about this, I feel like I need it. When do you stop and say no?
I say no when I don't think I can give somebody what they want, or when I think that they are doing something for the wrong reason, or if I think they have some sort of body dysmorphia, or some sort of, they're not in a good psychological headspace. Those are the reasons I would say no. Or if I don't agree with what they're asking for. They might be totally corpus mentis, but want something that I just don't think is going to look good for them. I'll tell them no in that case as well.
Without naming names, is there anyone who you feel like you have really helped to transform their look and thus their career?
Oh, the endless amount. Yeah. A lot of people. Yes.
And what does that feel like?
It's amazing. It's great. I love it. It's one of my favorite things. And like, that's kind of the practice that I built. Everything I do has been honed and perfected over the years to create a very undetectable yet effective result. I mean, that's the practice that I built. So that's why I take care of the people I take care of, because they know we're going to keep them just popping just the right amounts so that they look great, but completely undetectable. So yeah, it's every day I take care of somebody in that situation.
What does the days and weeks leading up to award season, or the Met Gala, or some huge Hollywood event, fashion event, what does that look like for you?
Yeah, those times get very busy, and people coming in and flying in, and so oftentimes we're there really late at night, a lot of house calls, that type of thing. For the Met Gala this year, we went to New York a week before. I like to go to New York anyway. We do pop-ups there, but we time that one in connection with the Met Gala. So yeah, just taking care of a lot of people getting ready for those things.
And what are most people getting leading up to that?
For the people who are getting ready and are here in town and are in a week before, everybody gets Instafacial, every single person. If it's within 2 or 3 days, we don't do that, because might look a little red by the 3rd day. So Instafacial for sure for people who are ready, can do it 4 or 5 days beforehand. For those people who are within that window, then a lot of facial sculpting, very, very delicate facial sculpting, just to pop their contours and give them a little V-shaped lifts and things like that. It's all non-surgical a week before, no surgeries a week before. I do a lot of surgeries for people to get ready, but that's a month or further out than that.
I have a random question. It was something as I was thinking about you coming in today, is I have 2 kids, and I've always had this weird, I don't know, like this practice of my kids get out of the bath and I do like a full, I call it like spa time. Like I do a full body of lotion and on their face and like literally in every crevice. And I was thinking to myself, is that actually what I should be doing? Of like putting clean products, but like putting clean products all over them and on their face, like their baby skin. And I'm like, they have such perfect skin to start. Like, am I doing the right thing? Or at what age do you start to do that? Or what are your thoughts on baby skincare?
Yeah, I didn't do anything like that with my kids. I wanted them to be as dirty as they could be most of the day, so they get exposed to everything. You don't want your kids too clean, because then the studies have shown people who had their babies basically protected in bubbles develop all kinds of autoimmune disorders because their immune systems don't develop. So I was never too vigilant in that regard. I mean, we give them baths and stuff, but I wasn't like overly like, you got to be perfectly spotless clean. Like I wanted a little grease and grime and dirt on them so they could develop resilient immune system. So, are you hurting them? No, but is it essential to do that at a baby age? I don't think so.
What are things that we can be incorporating into our routines to keep our skin plump and bouncy and vibrant and like head to toe?
My best recommendations are a 360-degree approach. It's everything we talked about, from diet to exercise to sleeping well to being well hydrated to using bioregenerative treatments. For us, my best I can do is use Metacine, the Instafacial collection, and do in-office skin treatments as well. There's nothing, but right now, there's nothing better. There's nothing better that you can do. And it's very, very, this combination is very, very effective.